You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how to make a tooth in a day. It's a new kind of dentistry, a healthy approach. With us, we have Dr. Carlston. Dr. Carlston, welcome to the program.
Thank you.
Big topic, Biomimetic Dentist. Did I say it right?
That's correct.
Now, what is that?
Well, the term bio, of course, implies biology. Mimetic implies to mimic. So we attempt to mimic the natural tooth structure as much as possible when we're restoring the diseased portion of the tooth.
Okay.
So we remove only that part of the tooth that's diseased whenever possible, and we restore it with that material that most closely mimics that part of the tooth. For example,
is there a crowd out there, by the way, that are looking for this kind of a healthy approach to dentistry?
More and more. Dentistry will be driven to a more conservative approach by the public.
Conservative meaning what?
Less invasive work, removing less tooth structure while restoring. We now have the adhesives and the materials that allow us to mimic the tooth as we restore it in a very conservative fashion, as opposed to covering the entire tooth with a metal reinforced crown. We can avoid that in most instances now.
Now, you're one of about 5 guys that do this biomimetic dentistry in the world?
No, there are.
Or just in the United States?
In the United States, if you go to the web and look for Biomimetic Dentist, you'll find a half a dozen sites. There are more than that who have been trained in this field. Biomimetic dentistry eventually will be the norm in dentistry. But
you say it's a discipline?
Absolutely, it's a discipline.
Really?
It's a very, very intricate.
But it's a healthy way of
restoring the tooth. Yes, we're
talking about crowns, by the way.
Yes, crowns and just regular restorations. If you're trained in biomimetic dentistry, you avoid as nearly as possible placing a full coverage crown on the tooth because it's very invasive. We don't want to destroy the natural flex of the tooth. When you have a natural virgin tooth that's never been worked on, there's a flex to it like this as you're chewing. Just like as you're driving down the street.
So it moves a little bit.
Exactly. As you're driving down the street in the car, you have a shock absorber. Okay. And the same thing with the tooth. The tooth actually flexes as you chew on it. And when you cover the whole tooth with a metal reinforced restoration.
With a crown.
A crown, you destroy all that flex, and so while the patient is chewing, the flex is gone.
So what's wrong with that flex being gone?
It's transferred down to the gum line and causes it to break down. That's why the average crown only lasts 6-7 years, because it breaks down the margins. The bacteria get up underneath those margins and cause recurrent decay. Okay,
now we've talked at length about this.
Yes.
I heard about it. I said, I've got to have him on the show. Sometimes, our show airs nationwide. I always feel like I've heard everything. But this is really a kind of a different slant, different what I normally hear. So crowns are being done every day.
Thousands
a day, let's just say in LA, right?
Yes.
Like tens of thousands probably, every day. You say there's a better way.
That means
before, to somebody watching this, they know they have to get a crown. You say get a second opinion possibly, look into biomimetic dentistry. But what's the difference? I mean, what's the difference between traditional crowns and what you're doing?
When a patient comes to me, I can avoid a crown 90% of the time.
Really?
Absolutely.
Okay.
Because we have the adhesives now and the materials that can bond to the tooth. So we only have to remove that part of the tooth that's broken down.
So just the top?
Yeah. If the decay is down deep into the dentin, we restore that part of the tooth with a material that very closely simulates dentin. It flexes like dentin, it compresses like dentin, and so that's what we use in the dentin to restore that. And there's a very specific procedure and sequence where you add these adhesives and these materials.
So now you call it a skull cap. It's a skull cap on the tooth rather than covering the whole thing. Okay.
We don't like to take the margins and move them all the way down to the gum line.
So what's the benefit to the patient, though?
The benefit to the patient is that you retain the flexural nature of the tooth, that shock absorber, that natural shock absorber.
All right.
That's the benefit. So the tooth lasts longer. When and if this skull cap fails, it fails up on top. So you can get at it and restore it. When the crown fails, it's down here, and you have the new crown, you have no choice but to replace it with a new crown.
I didn't know that. Crowns only last about 8 years.
The average
they can last longer.
Well, they can. Oh, yes. I have patients who've had crowns for many years in their mouth.
I don't have any crowns, but is it true that you get a lot of, over time, you get the gums, what do they, kind of fade away? What's that called?
Yeah, the stress of chewing causes all this flex to cause the recession of the gums. the gums shrink away, exposing the
So you
root.
don't get that with...
Well, you can get it over time because that's a natural function of aging.
Okay.
But with the margins way up in the top of the tooth and restoring, preserving all of the rest of this tooth structure,
okay,
you've got a much longer durability of the tooth, and so you're able to retain your teeth longer.
Is that right? Okay, now this Cerec machine. Tell me about this machine. It makes a tooth.
Yes.
But you don't use it the way other people use these Cerec machines.
Well,
right?
The Cerec machine is a wonderful tool for making minimally invasive restorations, but it can also be used for making restorations that, quite frankly, are more invasive.
When you say restorations, we're talking about crowns.
Crowns.
Okay.
Crowns principally.
Okay.
That are more invasive than conventional metal reinforced crowns.
Yeah, but I mean, the metal's stronger. Is that right?
Metal is stronger, so you don't have to reduce as much of the tooth. If you're putting an all porcelain restoration covering the whole tooth, you need almost 2 millimeters of reduction of the tooth down there at the gum line. That's a lot of tooth structure to sacrifice when you don't have to. With all these adhesives we have and these hybrid materials where we don't have to use that inflexible sandpaper called porcelain, because when you put porcelain in the mouth, it looks and feels beautiful, but it chews against whatever it chews against, it wears it out.
So if the other tooth isn't porcelain above it or below it or whatever,
you got it wears
is that
it out.
right? Now, I've never heard that. I mean, isn't porcelain the premier? I mean, this is the gold standard, the best stuff in the mouth? You smile when I ask you that.
It's the prettiest stuff in the mouth, but it's not the best.
All right.
No way.
Okay.
No.
Okay. Is this controversial amongst other dentists or other your friends?
Yes. You'll get some controversy with it.
And you're a holistic guy. Is that right?
I
mean, you eat like
I try to eat
food and
70% of everything I eat is raw, and I'm on a very active exercise routine, and I try to practice those same conservative principles in the mouth. You know, I said before that porcelain is the most attractive restoration in the mouth. It really is. It can be very attractive. But there are hybrid porcelains now that
That's
are not.
what you're using.
Yes, that are not abrasive, and that are still very attractive in the mouth, and yet they don't wear the opposing tooth.
Okay.
And they're more flexible, like the natural flexibility of the tooth.
So this flex that you say, this shock absorber, by putting this different kind of a crown on that you're doing,
yes,
that you make
yes,
in one visit,
that's right.
It keeps that flex, which ultimately, in your opinion, it keep your teeth around longer.
Exactly. It adds to the length, the longevity of the tooth. And you know, by the way, let's talk about the tooth. You know, you've all seen the Spider-Man movie.
Yeah.
And his outfit shows all these little webs going across his body. That's the way the lymphatic system is in our physical bodies.
Okay.
The lymphatic system is like a trash collector. It takes the toxins and eliminates them out of the body. Well, the tooth has its own lymphatic system. As the arterial blood enters the tooth, it carries with it a liquid that's a lymphatic type liquid, and it flows through those hollow tubules, because really if you take a tooth and cut it down and look at it under a high-powered microscope, it's nothing but a series of hollow tubes. And
really?
So it's constantly being lubricated by this lymphatic fluid that flows through the tooth. And so when you take and put these large, huge restorations
crowns,
on it's like putting a dam across the river.
When you say restorations, so I understand, we're talking about crowns?
Yes.
So when you put a large crown, you damage
you
flow.
You damage a lot of that flow through the tooth because you're removing so much of the tooth structure. And that's what keeps the tooth pliable and flexible. The whole body is flexible. When you're chewing on food, you're not chewing on a piece of steel. You're chewing on something that's a living organism, and so is the tooth.
Okay, so your philosophy then as a dentist, biomimetic dentist, got that right?
Yes.
Is to not destroy or carve down the whole tooth and put a crown on it. It's to just cover the diseased part? Is that right?
That's correct. That's correct.
And in that way you keep the flex, tooth lasts longer, less decay. It's just a better way.
Not only that, Randy, but we have techniques and chemicals where we remove the decay down to a certain level, then we put a certain chemical in there to tell us how much bacterial growth there is remaining in the tooth. And we can stop removing the decay at a certain point and avoid most root canals even.
Okay.
Because when you take the nerve out of the tooth, you destroy that lymphatic system, and the tooth
Is that right?
over time becomes a piece of petrified wood.
Is there science behind this? I mean,
absolutely.
So what's the #1 reason, though, that a crown fails if you have to do it every 9 years or so?
Recurrent decay around the margins.
Around the bottom of the tooth.
And the margins tend to open up with time because of the food we chew. That flex is gone in the tooth, and so it transferred down to the gum line, and that's where the margins start to open up. And over time, we can stick our Dental Explorer underneath the margins and find soft tooth structures, so we have to replace the crown.
So what do you do? Okay, so somebody has been told, you got to get a crown. Do you ask for a skull cap crown? Do you ask for a Biomimetic Dentist? I mean, what do you do?
Well, if somebody needs a crown, they need to at least get the opinion of a biomimetic dentist so they can be more conservative.